San Antonio, getting tested. Testing comes through the local health district first. So there's always going to be additional people, and it's going to change daily, especially now as more people are going to become exposed to either whether they're being traveled or whether they're being exposed to other places. So that number is going to change. So it's going to be hard to give daily updates on how many people we're monitoring.
What about the firefighters? We heard that there were some firefighters that are being monitored.
So we are monitoring people. We can't tell just based on HIPAA who we're monitoring, but we are monitoring people. But it's always a dynamic situation. If somebody's been exposed, we always contact them just for safety, because the whole purpose is safety of the community and containment. We are starting to validate the test, and they should be ready, up and running by March 23rd.
So what will be the protocol to administer these tests? Will it be through the hospital? Will it be through a person's physician? How will that work, and who will actually do the testing?
So all the guidance is through the local health district. So if there is any concern, the hospital will call us and we will give guidance. So anybody that has any concerns, whether they need to be tested, the call needs to come through the local health district first. And usually it's fever, cough, shortness of breath, and then exposure to somebody that has been tested positive or travel to an area of geographical concern. The majority of patients that have COVID-19, their symptoms are mild. So the easiest way to keep it from spreading is to stay home and to stay quarantined away from others.
In the meantime, if someone believes that they may have been exposed to something, they should call not their doctors but the health department?
Yes, they should call the local health department. Please don't go to the ER, especially if your symptoms are mild. Please call the local health department. We will guide you on what to do. There are still no positive cases of coronavirus in Corpus Christi, so we are still low risk, and that's the news. That's the good news. We have no positive cases. If there are any positive cases in Corpus Christi, we would hold a press conference. So all those rumors of people coming from San Antonio, getting tested, testing comes through the local health district first. So there's always going to be additional people, and it's going to change daily, especially now as more people are going to become exposed to either whether they're being traveled or whether they're being exposed to other places. So that number is going to change. So it's going to be hard to give daily updates on how many people we're monitoring.
What about the firefighters? We heard that there were some firefighters that are being monitored.
So we are monitoring people. We can't tell just based on HIPAA who we're monitoring, but we are monitoring people. But it's always a dynamic situation. If somebody's been exposed, we always contact them just for safety, because the whole purpose is safety of the community and containment. We are starting to validate the test, and they should be ready, up and running by March 23rd.
So what will be the protocol to administer these tests? Will it be through the hospital? Will it be through a person's physician? How will that work, and who will actually do the testing?
So all the guidance is through the local health district. So if there is any concern, the hospital will call us and we will give guidance. So anybody that has any concerns, whether they need to be tested, the call needs to come through the local health district first. And usually it's fever, cough, shortness of breath, and then exposure to somebody that has been tested positive or travel to an area of geographical concern. The majority of patients that have COVID-19, their symptoms are mild. So the easiest way to keep it from spreading is to stay home and to stay quarantined away from others.
In the meantime, if someone believes that they may have been exposed to something, they should call not their doctors, but the health department?
Yes, they should call the local health department. Please don't go to the ER, especially if your symptoms are mild. Please call the local health department. We will guide you on what to do. There are still no positive cases of coronavirus in Corpus Christi, so we are still low risk, and that's the news. That's the good news. We have no positive cases. If there are any positive cases in Corpus Christi, we would hold a press conference. So all those rumors of people coming from San Antonio, getting tested, testing comes through the local health district first. So there's always going to be additional people, and it's going to change daily, especially now as more people are going to become exposed to either whether they're being traveled or whether they're being exposed to other places. So that number is going to change. So it's going to be hard to give daily updates on how many people we're monitoring.
What about the firefighters? We heard that there were some firefighters that are being monitored.
So we are monitoring people. We can't tell just based on HIPAA who we're monitoring, but we are monitoring people. But it's always a dynamic situation. If somebody's been exposed, we always contact them just for safety, because the whole purpose is safety of the community and containment. We are starting to validate the test, and they should be ready, up and running by March 23rd.
So what will be the protocol to administer these tests? Will it be through the hospital? Will it be through a person's physician? How will that work, and who will actually do the testing?
So all the guidance is through the local health district. So if there is any concern, the hospital will call us and we will give guidance. So anybody that has any concerns, whether they need to be tested, the call needs to come through the local health district first. And usually it's fever, cough, shortness of breath, and then exposure to somebody that has been tested positive or travel to an area of geographical concern. The majority of patients that have COVID-19, their symptoms are mild. So the easiest way to keep it from spreading is to stay home and to stay quarantined away from others.
In the meantime, if someone believes that they may have been exposed to something, they should call not their doctors, but the health department?
Yes, they should call the local health department. Please don't go to the ER, especially if your symptoms are mild. Please call the local health department. We will guide you on what to do.
Hi, this is Rudy Trevino live at City Council chambers in Corpus Christi, where members of the City County leadership and the City County Health Department will be coming together in just a few minutes to address some concerns about the coronavirus. We've been told that someone has been exposed to coronavirus, not that they have coronavirus or they're showing any signs of the coronavirus, but they came in contact with people who were infected with the coronavirus and have been among some of the residents here in Corpus Christi. We're told that there are concerns about this, so we have representatives from the State Health Department, from the City County Health Department, and city and county leaders who will be addressing people's concerns about what is going to happen next and what they're planning to do in order to address this concern from some of the citizens who have apparently been in contact with or have been near people who were affected or in some way impacted by the coronavirus. Roy, if we can show the sign that's going to be shown to some of the folks here in just a couple of minutes before the press conference. This is a COVID-19 prevention strategy that is going to be displayed in just a couple of minutes. The press conference, by the way, is set to start at about 5 minutes here at the City Hall chambers. And you can see they're going to be stressing what we need to do personally to remain free of this virus as best we can. Of course, washing your hands and avoiding touching your eyes and noses and mouth, disinfectant surfaces and other objects. They're also going to include that phone number to the Corpus Christi Nueces County Public Health District. Also, they'll be introducing the new doctor who will be in charge of the City County Public Health District coming up in just a couple of minutes. But again, we are at City Hall here in Corpus Christi, where city and county leaders, along with the head of the Corpus Christi Nueces County Public Health District, will be addressing concerns involving someone or some folks who may have come in contact with someone who was infected with coronavirus. They're not saying that they have coronavirus, the people that came in contact with them, but we're being told that out of an abundance of caution, they will be addressing concerns of the community who basically are worried and genuinely, they have a reason to be worried, of course, but they're here to talk to us about what it is their game plan will be coming after today, what the game plan will be for the city and for the county to keep our residents safe. So that press conference here due to start in about 2 minutes. And again, we have members of the City Council, members of the County Commissioners. They're all here right now to talk to us and address members of the media about concerns over COVID-19 in Corpus Christi. So let's listen in and take a look at what's going to be happening. We're told that the press conference is going to start right on time. And if our photographer can pan over to the podium where all the city leaders and the county leaders and the health district leaders will be joining center stage here to talk to us about what developments have occurred since last night, we are told. We got a phone call from a county commissioner just before we went on the air confirming that there had been some sort of connection or some sort of I guess interaction with someone who had tested positive for coronavirus, not here in Corpus Christi, but in another location, and then that person came back to Corpus Christi, the one that had came in contact with the person who had coronavirus. So out of an abundance of caution, our city leaders and the health district will be getting together here in just a couple of minutes to talk about what steps will follow next. So we did talk to Dr. Anyufrak yesterday, who gave us some details on some of the things that we need to know about COVID-19.
Okay, this guys, they've got to be able to get in there. Hey. We are starting to validate the test, and they should be ready, up and running by March 23rd.
So what will be the protocol to administer these tests? Will it be through the hospital? Will it be through a person's physician? How will that work? And who will actually do the testing?
So all the guidance is through the local health district. So if there is any concern, the hospital will call us and we will give guidance. So anybody that has any concerns, whether they need to be tested, the call needs to come through the local health district first. And usually it's fever, cough, shortness of breath, and then exposure to somebody that has been tested positive or traveled to an area of geographical concern. So there's always going to be additional people, and it's going to change daily, especially now as more people are going to become exposed to either whether they're being traveled or whether they're being exposed to other places. So that number is going to change. So it's going to be hard to give daily updates on how many people we're monitoring.
What about the firefighters? We heard that there were some firefighters that are being monitored.
So we are monitoring people. We can't tell just based on safety of the community and containment. There are still no positive cases of coronavirus in Corpus Christi, so we are still low risk, and that's That's the news. That's the good news. We have no positive cases. If there are any positive cases in Corpus Christi, we would hold a press conference. So all those rumors of people coming from San Antonio, getting tested, testing comes through the local health district first. The majority of patients that have COVID-19, their symptoms are mild. So the easiest way to keep it from spreading is to stay home and to stay quarantined away from others.
In the meantime, if someone believes that they may have been exposed to something, they should call not their doctors but the health department?
Yes, they should call the local health department. Please don't go to the ER, especially if your symptoms are mild. Please call the local health department. We will guide you on what to do. We are starting to validate the test, and they should be ready, up and running by March 23rd.
So what will be the protocol to administer these tests? Will it be through the hospital? Will it be through a person's physician? How will that work, and who will actually do the testing?
So all the guidance is through the local health district. So if there is any concern, the hospital will call us, and we will give guidance. So anybody that has any concerns, whether they need to be tested, the call needs to come through the local health district first. And usually it's fever, cough, shortness of breath, and then exposure to somebody that has been tested positive or travel to an area of geographical concern.
Again, this is Rudy Trevino live at City Hall, where we are awaiting the start of a joint news conference with city and county officials, along with members of the City County Health Department. They're here to address concerns about the coronavirus and some issues that may have come up overnight regarding a person who may have been exposed to another person or persons who was infected with coronavirus. That is all we know. We've gotten confirmation from at least one county commissioner who shared with us information involving the person or persons who came in contact with a person who was infected with coronavirus, not here in Corpus Christi, but elsewhere. And then the residents from Corpus Christi, of course, came back home and interacted with other folks. So out of an abundance of caution, these city and county officials felt it would be important and necessary to address the community to, if anything, quell concerns about, the spread of the virus to our area. We still know that there are no confirmed cases here in Corpus Christi or Nueces County, and so we're awaiting the leadership to arrive here to address our concerns. Members of the City Council are here. We've got members from pretty much every first responder agency here in Corpus Christi and Nueces County also in the house. I see the city manager and the city mayor arriving right now, along with County Judge Barbara Canales. They're all making their way up to the podium right now, and the press conference is due to start here. Actually, it was set to start at 12 noon, now obviously running late, so they are making their way to the podium right now. I see the mayor walking up, and Barbara Canales, our county judge, also making their way, along with Annette Rodriguez from the City County Health Department, and Dr. Anufrak, Kim Anufrak, who we've been seeing this morning. So they are coming up to the podium right now. Let's see what they have to say.
All right, good morning, everybody. I'm Peter Zanoni, City Manager of Corpus Christi, and I want to welcome you to this joint Nueces County, City of Corpus Christi press conference this morning. This is an informational update for the community, and we're going to have several speakers talk to you this morning, including, beginning with Nueces County Judge Barbara Canales. Then we're going to hear from Mayor Joe McComb, Mayor of the city. I'm going to speak a little bit on city operations and what we're doing in the city as an organization to address coronavirus. And then our fourth speaker will be Annette Rodriguez, our director of our health department. So with that, let me have Judge Canales come up and begin our conversation.
Thank you, Peter. Thank you. Good afternoon, everyone. I'm Barbara Canales, Nueces County Judge. Accompanying me here today are many members of Nueces County Commissioners Court, and I'd also like to acknowledge there's a tremendous amount of public officials here as well. I noticed many city council members, Sheriff Hooper, other mayors of small cities and towns throughout Nueces County, and we're here for the purpose of a very important message, and that is your community is prepared and ready to handle what is known as the COVID-19 health crisis in our country and, in fact, around our world. Commonly, it is referred to as the coronavirus. And I know that you know this, but I think it's worth mentioning, again, how important public health is to not only the city of Corpus Christi, but to Nueces County. To all of our residents and visitors, I want you to know that this is our highest priority. Our public health officials are taking appropriate actions to ensure the health and safety of your community. I myself have been involved since January 24th with the partners that you see behind me. So I feel very confident, very, very confident in telling you that the purpose of today's press conference is to educate, 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 to keep the information flowing from public officials to citizens. And with that, I would like to introduce the best partner that I have throughout this, and that is the mayor of the city of Corpus Christi, Joe McComb.
Thank you, Judge, and we're glad you took time to join us today. This is a subject of interest to all of us. The good news is, and I won't say it slowly, but I'll say it loudly, is that we have no cases in Nueces County currently. And that's about as good news as you can get. And if you want to maintain and stay up with that, you can go to the city website or the county website, and you will be as current as we are in terms of the status of the cases. Both the websites are updated daily, and today, because of a lot of activity and because of the community's response, we have no active cases. We have been monitoring folks since early February when the story started getting out, and we'll continue to do that as this goes by. The best defense is to stay informed, to stay educated, and to stay safe, and to use those practices that you hear on every television station or read the newspapers, radio. Let's continue to personal hygiene and taking care of yourself. And at this time, I'd like to ask Annette Rodriguez, our Nueces County Medical District, to come up and give you from the professional standpoint so that she can address that. But from a city and a county standpoint, just remember the good news is that we have no cases in Nueces and Corpus Christi. Thank you.
Annette Rodriguez. I am the health director for the Corpus Christi Nueces County Public Health District. I just wanted to let everybody know that we have been working the health district since late January on this coronavirus situation. We're in tune to everything that is going on. We have been in partnership with the state health department as well as CDC. We just want to make sure that the community stays in tune to the changes. It's a quickly evolving situation, and everybody really needs to pay attention to what's going on. And like the mayor said, there are no cases of coronavirus here in Nueces County, which is a very good thing. But in order to keep the no cases here, we need to do our job. And so the health department has been monitoring people. We've been actually asking for people to self-observe themselves as well to make sure that the community stays healthy. We've reached out to all of our partners, our hospitals, our healthcare partners. We've reached out to different community partners, daycares, nursing homes, you name it. Anybody that'll listen, we're talking to them, we're explaining to them the CDC guidelines, and if they have any questions, they can always call us. We do currently have a hotline that is set up. It is 361-826-7200. So we also have a website. Both the city has a website and a link to the DSHS and CDC, as well as the county. So we hope that you guys utilize these different ways of staying informed. We all know that there is no vaccine. We all know that there is no treatment currently for coronavirus. There is, though, vaccines for seasonal flu. So people need to stay and get vaccinated. There is treatment for seasonal flu. There is the antivirals, the Tamiflu that they can use. So what can we use for the coronavirus? They're called non-pharmaceutical interventions. Those are interventions like washing your hands. It sounds very basic, but it's truly very important. So if you wash your hands currently 7 times a day, increase it by threefold, 21 times a day. Wash your hands as often as you can. That's very, very important. Also, social distancing is going to be so important. 6 feet, because when you sneeze, that's how the coronavirus is spread. It can actually go up to 6 feet. So stay at least away 6 feet from individuals that are sick. You should not be around sick individuals. We should try to stay as healthy as we can. So cover your nose and mouth when you sneeze or cough. If you use a tissue, throw it in the trash can and then wash your hands again. If you don't have a tissue, use the arm to cover your sneeze. So the other thing is that the most vulnerable population is the elderly, and y'all have all heard this. So we've looked at the statistics from China. The elderly, those over 60, those over 80, do not do well with coronavirus. So part of our job, as the rest of us, I like to include us in the other 80%, is to stay healthy, try not to get the virus. You know, we all see it. It's traveling. We see there's Houston cases. We know what's going on, which is a good thing. Know what's going on. And people travel a lot. So when we say we're monitoring people or we're telling them to self-observe, it's because they're traveling back from China or from these places where there's a high number of infections. And so we actually are keeping an eye on them to make sure that they stay healthy so the whole community can stay healthy as well.
All right, great. Thank you, Annette. Annette, as she introduced herself, is the director of our health district, our health department. I just want to point out that that health department is a joint operation between the city and the county, and they do oversee the public health of our Nueces County, so that's about 360,000 residents, right? So 360,000 residents, including 325,000 in the city. So they have a very important job. One of the things we have done this week is met with Annette and her assistant director, Dr. Dante, and we're redirecting several staff positions from other departments in the city to help Annette and Dr. Dante out at this point in time to give more resources to address increased call volume, to help the community in awareness and education. So we've directed about 20 additional staff from other departments to the health department to include executive positions, call takers, even people that purchase commodities that we need. I want to point out that all of our departments, we have 32 operating departments in the city of Corpus Christi, and I met with each one of them earlier this week to have them begin to rethink their business processes. And so the Center for Disease Control, you've heard of that term, the CDC, they have issued numerous guidelines on how first responders, airports, and other businesses can change practices to do what we've been telling you, which is practice safe hygiene and reduce the spread of coronavirus. So each of our departments today is developing a change of business plans of how can they change operations to make them safer, not only for themselves, the employee, but for the community. And so as an example, if you call 911 today and an EMS paramedic shows up from the city, they may have a face mask on and goggles depending on the situation that they're responding to. That's a good example of a business process change that we'll see in our departments going forward. We've also asked all the departments to evaluate what are the most critical services that they perform. In case there is a large case of coronavirus outbreak in our city, we want to know what do we critically have to continue. And a good example of that is our water, right? We produce water for 500,000 customers. We need to make sure we have water every day. And so we're looking at what are those critical functions that need to continue, and who are the critical staff, and who's the fallback staff in case somebody does get sick. So that's important to point out for our community. Nothing is closed in the city of Corpus Christi right now. There was some rumors that fire stations were closed over the weekend. Everything is open today, and these contingency plans and change of business processes will help to continue to make sure everything stays open for our customers and for the residents. We're also, in terms of preparing, we're also looking at options of what if, and you've heard many governors and mayors and city managers have declared emergencies. We're looking at and evaluating the option, if we were to declare a local emergency, what does that do to us, and how does that help us in accessing state and federal resources? So we're looking at that option as well. We are in the business of, as I mentioned, with our health district, keeping people healthy, and so that includes two things. One, if they get sick, we help them get to the right place, but before they get sick, we don't want them to, and so education is critical. And so a big portion of Annette and Dr. Dante's operation in the health district that serves both the county and the city is public awareness and public information. And so you've heard we have a website, we have a call number, that 826-7200. We want residents to use that number. We've increased the number of callers, call takers in our call center so that people can get basic questions answered. And more importantly, if you think you might have the coronavirus, that's the number you do need to call. You don't go to your doctor, you call the health district, and that's being done across the country. And so we want you to call that 826-7200 number. We are monitoring this not in isolation, right? Well, today we have many partners here, and there's more in the audience. We're connected statewide and nationally as well. And so we're doing conference calls daily with the state health district, or the state health department that has many other entities plugged in. Our department heads, our 32 department heads, our executives are reaching out across Texas to see what are other libraries doing, and what are other police departments and EMS departments doing, so we can learn from them and take away some best practices to employ here in Corpus Christi. On Friday, I'll be joining a conference call with big city managers from across the country. There's a network of big city managers that meet periodically through the year, and we're going to do a conference call this Friday to see how we, as big cities across the country, what are we doing differently, and how are we handling coronavirus, so we can learn from each other and help to reduce the number of cases and keep people safe. I just want to close by, and I'm going to turn it back over to County Judge Canales, but the key things to remember is that telephone number, the 826-7200, and so that's the number you call if you have questions on coronavirus. It's also the number you need to call if you think you're sick. You do not just go to your doctor's office. What you need to do is get instructions and directions on how to proceed, but you have to, according to the federal government, call the health district first, and that's to keep you safe and keep your doctor safe and people that may be in a doctor's office waiting room. The other important thing is there are no cases in Nueces County or the City of Corpus Christi. Another important thing, we've heard the medical experts tell us this, and we've heard it since we were kids, right? Children, is wash your hands. Constantly wash your hands, and do not touch your face as well, right? The coronavirus, just like any virus, gets into your body through your face, through your eyes, through your nose, your mouth. So don't touch your face, and wash your hands, and use that 826 number, and also use our website. We're constantly updating that website. There's a lot of good information on there and a lot of good links as well to other national and local sources of information. The best thing we want to do is keep people informed. That's why we're doing this press event today. But that takes all of us to do our part to read what's given to you, and it's there to help us out. So if we all do our part, this won't be a problem. So thank you for your time this afternoon. With that, we're going to turn it back over to Judge Canales.
Thank you so much. I also want to direct the attention to everyone here in the audience. I know it's a little hard with the cameras, but the cameras can help us do a good job, and that's make sure that you get a real good shot of this very important piece of graphic, this sign, this poster that really illustrates those top points that Manager Zanoni just went over. It not only gives you the prevention recipe to keep our community healthier, but it also gives you that hotline number and also refers you to a website. In fact, I'm going to encourage everyone to get on that website. No matter how much you think you know, get on the website. Get on City of Corpus Christi's website. Get on nuecesco.com website. There's a tremendous amount of information on there, including frequently asked questions that could be very helpful to you, to your family, or to your business. In addition, we are going to be available for questions. We are also going to be available to make this presentation and of course, the highlights in Spanish. We recognize that we have a very large Spanish-speaking audience, and this will be absolutely important that we communicate with that audience all of the information that you've heard here today. let me reassure that we are working together as a region with all of our medical emergency management and public health officials, as well as all the agencies Manager Zanoni referenced. Some of those are in the audience, and I'm going to invite them while I finish these comments to join me behind us so you can put a face to our partners. These include the Coastal Bend Regional Advisory Council, represented by Hillary Watt. I see Danielle Hale coming here, Emergency Management Director of the Port of Corpus Christi. I see Nueces County currently Director, Emergency Management, Melissa Munguia. I know Sheriff Hooper is here, Mayor Gilbert Gomez. Please come forward. You represent a very important part of our Western County. Let me assure you that I've been able to make phone calls along with Melissa Munguia, Emergency Management Director, to all the small cities and towns that make up the western part of Nueces County, all the way to Port Aransas. This is a complete joint effort that's taking place. And why? Because we want to be as prepared as possible for a unified message, a unified response. I'd like to refer back to something that Manager Zanoni referenced, because it also applies to your county. You might see in the coming days or weeks or months that Nueces County feels it's in the best interest to declare a local disaster declaration. This could happen. However, this does not mean that we are in a state of emergency. What it does mean, and what it does do for us, is it allows first responders, planners, emergency management directors, myself as the emergency manager head of our county, to open the door for resources and assistance at the state level. And while Gary was working to get here, I know he's not here yet, we've been very closely in contact with TDEM, the Texas Department of Emergency Management. And when you put us all together here, combined with all of your representatives from commissioners to city council, men and women, you should feel really good that this team behind you can deliver the very best preparedness and the strong unified response that you would expect from anywhere in the country. And so we continue to use best practices. This is a dynamic and very fluid healthcare scenario going on around the world. If you get on those websites, the first thing you're going to see, the very first thing, is that message to call your local health authority. We have plenty of people to answer the phone, and we will get more if needed. We will do everything to answer your questions in a way that makes you feel good about what your next steps are. The next thing you're going to see is current status. This is also interesting because you will be able to have every 24 hours, just like I do. That's what open government's about, the current status of our county. So I believe that it's going to be imperative that we all team up. This unified effort behind me, they're strong, but we're stronger collectively. So all of us can be a part of this messaging and this important effort of social distancing, of making sure we wash our hands, making sure that we don't touch our unwashed, with our face with our unwashed hands. These are the steps that are the most important that we want to make clear. And of course, if you're sick, stay home. If your children are sick, they need to stay home from school. Those are the most important and valuable lessons that you have learned here today. And with that, I want to thank, Mayor, join me here. I know you want to thank everybody behind me, but particularly, it's important to note that the Public Health District, the City County District, is represented by a director who has over 21 years of experience, including Zika, West Nile, Ebola, SARS, H1N1, regular influenza. She has an amazing team, including Dr. Kimberly Onifrak, and so who is the alternate local health authority. We have representation from an infectious disease specialist in our region who is on call and has been assisting us for over 40 days now. You can see why I believe that Corpus Christi, Nueces County, and we're even going to reach out to our regional partners. We're ready to tackle what comes ahead. And so I want to thank you, first responders, Billy, Melissa, Mayor, Danielle, Hillary, who represents all of the trauma regional assets we have in our community. Dr. Onifrak, Annette, and Mayor McComb. And thank you for attending, and thank you for the media to help us in this very important undertaking of messaging to our public. With that, I'll yield, I'll step back and ask if there are any questions. I'm going to yield that to Annette Rodriguez to answer that.
That's a great question, and that's actually a local decision that's made together with the school districts and the health department based on the situation at hand. So you have to see how many cases do you have, what exactly are you looking at before you can make those decisions. So at this time, the answer would be no. Well, that's something that the University, Del Mar, we've talked to them both about this, and that's something that they can actually implement. At what point they'll implement that we don't know at this point.
Do you have any folks here who've come in contact with those who may have had corona or COVID-19?
What we do have is we have people that have traveled to places that have a lot of infection, like a lot of coronavirus there, and they've traveled back to Corpus. And so what we do, just in an abundance of caution, to be honest with you, is that we tell the individuals that have come in contact with these people that they need to self-observe themselves. So basically just make sure you're healthy. So before you go into a congregate area, make sure you're healthy before you go back to work. Make sure you're healthy, you're not sick, you're not running temperatures, you're not coughing, you don't have shortness of breath before you go back to school. All of those things, it's basically changed from, it used to be a monitoring, but the CDC guidelines changed recently because there could be so many individuals that have come in contact with people, it would be impossible for the health departments to keep up with all of them. So now it's self-responsibility. Everybody has to be responsible for self. Make sure you're not sick, like the judge said very eloquently, before you go to work. Make sure you're not sick before you go to the hospital to work. Make sure you're not sick before you go back to school. Especially make sure you're not sick if you're visiting a nursing home, you're visiting grandparents. We know that's the vulnerable population.
Annette, this young lady had a question. Oh.
Okay, so it's the same thing. It's basically, you know, somebody that's traveled and they've come back and they're not feeling well. And so, you know, again, just to be overly cautious, we're telling people that may have come in contact with this individual, self-observe. So make sure that if you're a parent, self-observe your child to make sure that they're not sick before you send them back to school. So, and that's for a 14-day time period from the time that they may have come in contact with the individual for 14 days because that is the incubation period. We probably have what? A few?
That number changes.
That number changes all the time, so we only have a few at this time, so. No, we're currently not testing here. Our goal is to start testing the week of March 23rd, but currently, right now, we are not. We do have kits. What we're doing right now is that we had to upgrade our biological safety hood so that we could start testing. So we do have kits ready. We're just upgrading that hood. Once it's ready, hopefully the week of March 23rd, then we'll start testing as well so our laboratory response network can help CDC with the surge capacity. How many test kits? I think we have the capacity, I don't know the exact number, but we have the capacity to do at least 26 per day. And so we have quite a number of them. Actually, at this time for Nueces County, very, very low risk because we have no cases, but we're still asking if you're traveling here for spring break that you social distance. I do know that, but that's not information that I'm going to be giving out at this time, so just for the protection of those individuals.
New guidelines, the CDC new guidelines for first responders. What are some of the things that we will notice? Will they be wearing masks when they go to
Yes.
certain incidents?
So there's certain things like when the call comes into dispatch, they might hear like they've traveled recently to a certain area that's highly been infected. It could be China, it could be Italy, it could be, there's so many of them now. So that's going to be a trigger for them to listen to because they know that that's important. If a person is calling because they have ILIs, influenza-like illnesses, they're also going to be looking at that they need to wear their protection. That's just kind of immediate. They don't know what they have. They know it's ILI. In the normal flu season, we would just say that's influenza-like illnesses, but for this, since we do know that coronavirus, is already in Texas, they would be covering, like the city manager said, goggles cover their eyes, and then the mask to cover their nose and mouth.
So if someone calls 911, should they disclose that they are feeling sick or have traveled elsewhere? Will that be
Absolutely.
asked by the 911
Absolutely,
operator?
and that's actually added to the dispatch questions. So they're asking, have you traveled recently? If they've traveled within the 2 weeks, where have you traveled to? So they've added that. They've changed their processes to add that in so that way that they will well be protected. Yes, and that's a great question. So I have reached out to them, and I've talked to a few of them, and I'm actually meeting with them again on Friday. And so, we're actually asking them to implement a lot of these same things we're talking about before visitors come in. Make sure that they're not sick. You don't want visitors there. Make sure that they do not have ILI symptoms because you don't want them there. Make sure that they're not all congregating together in the dining area, social distancing, certain staff or certain people only. So there's a lot of different things that we're suggesting to them. It depends on the setup of their facility, so how they're going to do this.
So I think with that, we are going to conclude this joint city-county press conference. We thank you for coming. We are going to be here available. I know Annette will be available here for Spanish. Dr. Dante Gonzalez, if you'll come forward, he will be available for interviews in Espanol. Thank you again.
Just this one? Oh, shoot, man. Okay, we just finished hearing a joint news conference with the city manager, county judge. We're going to be talking to County Judge Barbara Canales right now, and forgive our little mic situation here. But what we want to find out, Judge, is that there are so many folks out there who are talking about how they know that they've traveled areas
Yes.
where people may have been in contact with someone who has the COVID-19.
Absolutely.
I mean, how are we going to reassure folks that they're not among us now?
Right. Well, look, I think the most important piece of this is that we have to learn how to mitigate through self-observation. There is a big curve out there, right? And that's maximum exposure. And what we seek to do is flatten that curve. And what we can do to flatten that curve is when we travel, we need to make sure that we're practicing these very basic but so vitally important tools of washing hands, of making sure we're not touching our nose and face with unwashed hands, and most importantly, social distancing. And I think that when we do that, we can learn how to mitigate our additional potential exposure. But virus knows no borders, Rudy. They know no boundaries. And so we know the virus is in Texas. We know that people are traveling every day. So it is very foreseeable that you will see additional cases. It could happen that we see a South Texas case. But I want people to know, more importantly, that what we need to do is to make sure we can contain once we know that somebody's sick. And to do that, you've got to learn how to just tell yourself, before I do anything, if I think I'm sick, I'm going to call 826-7200 because they're going to give me the information that I need to minimize that exposure.
That's what we want to do, is we want to reassure folks that
Yes.
if you have a question, it can be answered.
Right. Absolutely. It can be answered. We will get back to you. We have the right medical experts on our team. We're working with super trained, highly trained individuals. And the most important thing is that we didn't start training today. We've been training since we knew the coronavirus was reaching epidemic levels. When it left China, We made the adjustments here in our office at the county, and the city followed suit. So even though this is our first press conference, rest assured we've been working as really round the clock to make sure that these preparedness measures are undertaken. But I do want people to know, if you see that it happens in Texas, cases rise, this is expected. This is what the experts tell us. But what we know we can do is it's our power to mitigate. It's our power to take that level from here to here. We can do that, and that's what today's message was all about.
Let's talk about other communities have canceled events.
Absolutely.
San Antonio, Austin.
Big events.
What about us?
So I think that every local jurisdiction needs to make the best decision given the circumstances, right? So I think for me at the county, what I'm going to be looking for are opportunities to limit large social gatherings, because I think that's the best in our interest. The city's going to be looking at the same type of events. I think what we really need to do is follow best practices, which is why universities have shut down. So why have they done that on the East Coast and the West Coast? Not because they have a lot of coronavirus cases, but because they want to take that exposure down. So anywhere where we can make good decisions like that, we're going to evaluate based on our status, which is changing every day, and we're going to make the best decisions.
And that's what we want to be able to send out,
Yes.
the message that we want
Yes.
to send out to,
Yes.
to folks out there. If you don't have to go out,
Right.
you don't have to be in these social gatherings.
Don't.
What about block parties and
Yeah.
things like that?
So I think the rule of thumb that I heard today was the governor mentioned, a couple of 250 people or more is definitely too big, but under that is, probably all right, as long as you practice this social distancing. So I told everybody in court today, I love to shake hands. I love to greet people. I'm even backing up here because I want to show people a smile and a hello, right? I want us to smile. I want us to say hello. We are a cariñoso people.
Absolutely.
And we're going to have to retrain our brains while we're undergoing this healthcare crisis in our country. But I know we can do it, but we're going to have to be smart, and we're going to have to educate. And I want everyone to remain calm, because I want you to know that we're trained, we're ready, and we're prepared.
Thank you so
Thank
much.
you.
We appreciate
Thank
your
you so
time
much.
here.
Thank you.
And you're listening to it unfold here at the City Council chambers in Corpus Christi, where we've had a large group of local leaders, along with the health department, getting together to remind folks at home of personal responsibility, that space, the washing of the hands, and avoiding large crowds. So we will be putting together a full report, a team report of what happened here today, what we need to know, and what you need to know about remaining safe and COVID-19 free. Now, we've got a report for you we'd like to share with you.
There are still no positive cases of coronavirus in Corpus Christi, so we are still low risk, and that's the news. That's the good news. We have no positive cases. If there are any positive cases in Corpus Christi, we would hold a press conference. So all those rumors of people coming from San Antonio, getting tested, testing comes through the local health district first. So there's always going to be additional people, and it's going to change daily, especially now as more people are going to become exposed to either whether they're being traveled or whether they're being exposed to other places. So that number is going to change. So it's going to be hard to give daily updates on how many people we're monitoring.
What about the firefighters? We heard that there were some firefighters that are being monitored.
So we are monitoring people. We can't tell just based on HIPAA who we're monitoring, but we are monitoring people. But that's it's always a dynamic situation. If somebody's been exposed, we always contact them just for safety, because the whole purpose is safety of the community and containment. We are starting to validate the test, and they should be ready, up and running by March 23rd.
So what will be the protocol to administer these tests? Will it be through the hospital? Will it be through a person's physician? How will that work, and who will actually do the testing?
So all the guidance is through the local health district. So if there is any concern, the hospital will call us and we will give guidance. So anybody that has any concerns, whether they need to be tested, the call needs to come through the local health district first. And usually it's fever, cough, shortness of breath, and then exposure to somebody that has been tested positive or travel to an area of geographical concern. The majority of patients that have COVID-19, their symptoms are mild. So the easiest way to keep it from spreading is to stay home and to stay quarantined away from others.
In the meantime, if someone believes that they may have been exposed to something, they should call not their doctors but the health department?
Yes, they should call the local health department. Please don't go to the ER, especially if your symptoms are mild. Please call the local health department. We will guide you on what to do.